بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. This is a new case discussion, and we have discussed in this axial MRI, CT, MRI axial view. After contrast, as we see here, we have a pancreatic mass, hypointense pancreatic mass, and in the region of that body and tail of the pancreas. And the mass, it is breaking through the pancreas to the adjacent soft tissue. And the mass also causing the upstream pancreatic atrophy. Also, there is another findings. As we see here in the liver in segment 6, we have hypodense area, hypointense area, non-enhancing in the liver, and another irregular mass lesion at the tip of the spleen. So we are dealing with the malignant pancreatic mass lesion, and the most common pancreatic mass lesion is adenocarcinoma, pancreatic adenocarcinoma. Here we have some facts about the pancreatic adenocarcinoma. It is usually on the CT scan, hypodense, poorly enhancing, marginating mass with tendency to extend to the mesenteric vasculature, and usually causes pancreatic and biliary obstruction. But if it is in the region of the head of the pancreas, and we have double duct sign, and also causing upstream parenchymal atrophy. On the MRI, we have, as in our case, hypointense mass lesion compared to the normal pancreas here. It is high signal intensity and variable signal in T2, and it is after contrast there is hypovascular mass lesion, but there is delayed in enhancement. And there are commonly metastases to the liver, to the peritoneum, and to the lung, and in our case it is to the spleen. And also we should differentiate from another mass lesion, little bit common in the middle-aged woman, mucinous cystic neoplasm. And the location of the mass lesion is commonly in the tail, and it is typically cystic in appearance. And with some solid component can be seen in the mass, and also there is no pancreatic duct communication or obstruction. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. Thank you very much for listening, and hoping to see you soon in another talk.